Hi, I'm Cindy Koshatka, president of the Northern Virginia Mental Health Foundation. And joining me is Lauren Blackwell, the foundation secretary. And we're here today to tell you a bit about our foundation.
Thanks, Cindy. I'm so happy to be here. Would you like to start off giving everyone an overview of what the foundation does?
I think that's a great idea. Northern Virginia Mental Health Foundation helps individuals currently in treatment for serious mental illness by providing the funding these individuals need to help them achieve their wellness goals. We are a 100% volunteer-run board, and in 2021, 93% of donations to our foundation went directly to the community we serve. We've been serving the Fairfax and Falls Church, Virginia communities for almost 30 years and have impacted more than 6,000 individuals in mental health treatment. Some of the most frequently asked questions we receive are about the foundation's grant-making process. So Lauren, maybe you could dive into that?
Absolutely, that's perfect. One of the things that really sets the foundation apart is that our grant making is so expedient and it's an easy process to navigate. Individuals who are receiving treatment at the Fairfax Falls Church Community Service Board, or CSB, which is a public mental health agency in Fairfax County, Virginia, apply for grants with support from their case managers. Grants must be part of their treatment plan and usually range from $25 to $2,000. CSB case managers send grant requests to the foundation, and we don't have direct contact with the individuals and families who receive the grants. Then our board of directors reviews the grants, and we approve approximately 95% of submitted requests, which is a number we're really proud of. Cindy, maybe you could tell folks a little more about what the types of grants we approve?
Sure, Lauren, I'd be glad to do that. In 2021, our foundation fulfilled 34 individual grants and 67 medical copays, and we served over 100 individuals, spending over $22,000 in total grant making. Of this total, 14 individuals received $9,000 in medical and dental assistance. 17 individuals received $8,700 in funding for housing and employment. 67 individuals received almost $4,000 in funding for medical copays, and 3 individuals received almost $500 in funding for nutritional, health, and social needs. I think some of our feedback from case managers really bring alive those numbers. Lauren, would you like to kick those off by sharing a story that really impacted you?
I'd love to, Cindy. One piece of feedback we received from a case manager had to do with the support the client received from us when we funded a rec center pass. The case manager told us that the individual self-care started with participating in swimming. I love swimming myself, so I totally see that, but then developed into joining recovery-based groups. So she had a decrease in her symptoms and was able to recognize the need to focus on treatment and recovery. And the case manager said that the opportunity may have saved her life, and she was given the opportunity to find one thing that really allowed for self-care. And I find that just so moving. Cindy, what's a story that really spoke to you?
Hearing about a case manager's client who is a refugee who had experienced trauma and who has a painful autoimmune disease and was also experiencing pain due to needing dental care, but not being able to access it. He received a grant from us for dental care and reported that he is, quote, now feeling less depressed and more hopeful, not only because he's experiencing less pain, but also because he believes that he is not alone in this country. His hope is renewed because people care about him.
That's so sweet. That's a really great story, Cindy. I really like that one. Maybe we could each share one more story?
I would love to. Another story I appreciated hearing about was a client whom the foundation helped with phone bills. And the client used the phone to engage in outpatient mental health and medical treatment, and also began looking for a part-time job so she could pay bills. The phone helped her remain connected to treatment services as well as to social supports, members of her church, and supportive family members.
That's so wonderful to hear. I also have another story that involves another area of personal passion for me, which is board games, always fun. So the foundation helped an individual obtain a vision exam, which prevented further vision impairments and allowed her to resume playing board games with her family and entertaining her great granddaughter by reading to her, both of which are vital to her well-being. And the case manager said, because of the contribution, she can see better, connect better, and maintain the lifestyle she desires. The individual will be forever grateful to the foundation.
And we're grateful also to serve the community and have the honor of hearing individual stories of resilience.
That's right. Our work is so meaningful to us and the rest of the board, and to all of our donors and those who volunteer with us, and to the case managers and clients who we serve.
And we hope that includes you, our viewers, as well. We invite you to learn more about us at our website, novamentalhealth.org, or to reach out to us directly at 703-853-1970. Thanks so much for your time today, and we hope you have a wonderful rest of your day.
Thank you. Bye.
Bye-bye.